Hi, good evening, friends, and few of my thoughts about cancer. The moment we hear about the word cancer, the general perception is that are we talking about a disease which is indirectly like a death sentence? However, over the next 20 to 25 odd minutes, I would like to take you through the facts and of cancer, and I'm sure I'll try and demystify some of the misconceptions associated with cancer. So, cancer, as we all know, is the leading cause of death worldwide, accounting for nearly 10 million deaths or nearly 1 in 6 deaths worldwide. That's what's happening. Cancer causing infections such as the human papilloma virus and the hepatitis B virus are responsible for approximately 30% of cancers in low and lower middle income countries. The most common cancers are breast, lung, colon, rectum, and prostate cancers. However, in the Indian perspective, oral cancers are one of the most common cancers. Around one-third of deaths from cancer are due to tobacco use. Also, because of high body mass index, alcohol consumption, low fruit and vegetable intake, and lack of physical activity. So we are looking about a death rate of close to 27%. I know that this particular slide is extremely demoralizing. However, all is not that bad. There are quite a few relieving facts as well. Many cancers can be cured if detected early and treated effectively. Cancer develops over many years and it's not deadly until very late in its course. Cancer is not like some viral or bacterial infection which enters into your body today and tomorrow you start getting symptoms. Cancer is caused by certain changes which occur in the normal cells of your body. Hence, it takes a period of months or years before the normal cell gets transformed into a cancerous cell. Precursor lesions can be identified in individuals at risk for cancer, and cancer is prevented by obviously eliminating the precursor lesions. So, cancer does give us lot of warnings, and it is a slow growing process. So to understand or learn about cancer, one needs to have a look at this graphical image. At the top end of the image, as you can see, that's a normal cell. And this normal cell, when it goes through some mutation caused by some cancer causative methodology or an agent, then it becomes an immortalized cell. And this immortalized cell goes through a further transformation in the form of promotion and progression, and it gets transformed into cells which have the capability to invade the blood vessels or the lymphatic stream and spread to other parts of the body, which we call it as metastasis. So this is how a normal cell gets immortalized, and if a cell is destined to live for say 24 hours or 36 hours, it continues to live for 7 days or a month and forms a tumor as we normally are aware about. Now, what are the causes of cancer? If you look at the etiology of cancer, there are non-modifiable risk factors like age and heredity. Age, as an individual increases in his age, the exposure of environmental factors on that particular individual increases and he or she is prone to develop various forms of cancers. Second cause is hereditary. In heredity, whatever the transmission, genetically transmitted factors are there in our body, they are responsible for causation of certain cancers. Not all cancers are hereditary. There are modifiable risk factors. In fact, we say that the non-modifiable risk factors, heredity, accounts for only 3 to 5% of cancers. 95% cancers are caused by modifiable risk factors like dietary factors, addictions, overweight and physical inactivity, microorganisms including viruses and bacteria, environmental factors like ionizing radiation, ultraviolet rays, chemical factors like harmful chemicals, dyes, particularly occupational exposure to harmful chemicals in industry is responsible for causing certain type of cancers. If you look at the heredity and cancer, the major cancers which have a hereditary preponderance are leukemias or blood cancers, breast cancer, retinoblastoma or the eye cancer, and colorectal, that's the intestinal cancers which are there. If you see over here very carefully, you will realize that if a couple is there where one of them has this gene which is transmitted, then in what format does it get transmitted into the second generation or from there to the third generation which is there. So this slide does give some relief in knowing the fact that not every child suffers the genetic transmission or the hereditary transmission. If you look at addictions and cancer, as I said that tobacco and alcohol, the most important or the biggest culprit I would put as far as causation of cancer is concerned. In Indian scenario, we have a wide variety of tobacco which is available, ranging from these packaged products called as gutka or pan masalas to the what is being prepared indigenously. Now, tobacco-related cancers, almost 35 to 50% of cancers are caused due to tobacco. If you look at the oral cancer, this is a tongue cancer, this is a cancer of the buccal mucosa or the cheek, the cancer of the jawbone which has now come out on the surface, bladder cancers, lung cancer, and cancers of the esophagus or the food pipe. If you see over here, this blackish one is the picture or the specimen of a lung of a person who is exposed to tobacco or smoking for a long time, and these healthy pink-like lungs are seen in non-tobacco consuming individuals. Obesity. In fact, obesity or adiposity is also what we call it, is one of the major causes for intestinal cancers as well as breast cancer in women also. In fact, in ladies, they say that every 10 kg of weight gain is associated with a significant increase in post-menopausal breast cancer. Along with that, we have the uterine cancer, cervical cancer, pancreatic cancers, and gallbladder cancers, which are directly linked to obesity and physical inactivity. Various microorganisms and cancer, if you look at this, as I mentioned, hepatitis B and hepatitis C are associated with liver cancer. Human papillomavirus is associated with the cervical cancer, penile cancer in men, and head and neck cancers. HIV or human immunodeficiency virus is associated with the Kaposi sarcoma or the carcinoma of the cervix. H. pylori is associated with stomach cancer. Schistosomiasis, it's basically microorganism, is associated with the bladder cancer. And HTLV or human T lymphocytic virus type 1 is associated with leukemias and lymphomas. What are the warning symptoms of cancer? Cancer develops over a period of months to years, and since it is a change which occurs inside our own body's cells, usually patients do not realize the symptoms in the initial part, so it has a long preclinical phase as we call it. However, once the cancer starts affecting the organ of origin or it starts spreading to other parts of the body, then is where we see the symptoms. So symptoms could be like any lump or swelling over the body, a non-healing wound or ulcer, any lady who has intermenstrual bleeding, it could be postcoital or postmenopausal, it is a sign of uterine cancer. Difficulty in swallowing is a sign of the cancer of the food pipe. Any persistent chronic cough or spitting out blood or change in the voice is a symptom of lung cancer as well as cancer of the throat or of the windpipe. Any bleeding during your bowel habits, which is that could be a sign of rectal cancer. Any changes in bowel habits could be a sign of colon cancer. Once the cancer spreads to other parts of the body, like liver or bones or lungs, then we are talking about other symptoms like weight loss, loss of appetite, backache, headache, all that. How do we diagnose cancer? Cancer can be diagnosed based on a high index of suspicion with a few simple tests like blood and urine examination, X-ray, ultrasonography. In case of women for breast cancer, we have mammography. Tumor markers, these are a set of blood tests which are available depending upon the type of cancer or the organ of origin. These tumor markers help us to prognosticate whether it is not diagnostic significance, the prognostic significance, whether the patient has cancer or no, and how he or she is responding to the treatment of cancer. We have diagnostic endoscopies, biopsies, pap smear, and well, the most important, this one is a PET CT scan evaluation, which is a positron emission tomography CT scan, which will show whether the patient has cancer or no. It's a whole body scan, and also will show which all parts of the body the cancer has spread, and it is also a wonderful tool to find out how is the response to treatment when we compare the baseline scan and the follow-up scan. Now, what are the treatment options available for cancer? Well, the major treatment options, as we know, are surgery, chemotherapy, radiotherapy, and immunotherapy. Surgery has got a phenomenal change. It has occurred. Now we are talking more of organ preservation surgeries. Chemotherapy is now available in the form of injections as well as tablets. Radiation therapy, we have definitely moved ahead from the era of cobalt therapies to the now latest VMAT and tomotherapy or IGIT therapy, and immunotherapy, where we are talking about using the patient's own lymphocytes or the body mechanism, doing some genetic alterations in that to see how the patient it can benefit the patient. This is the Cambridge Medical Robotics Versus system, because now robotic surgery is there to stay. It is now the newest kid around the corner, I would put it, because robotic surgery does help perform keyhole surgery or surgery inside the thoracic cavity and abdominal cavity very, very precisely with minimal pain, minimum infection, minimal blood loss. And at HCG Manavata Cancer Center, today it's a proud moment to share with you that today I've done my 500th robotic surgery in a span of a little more than 2 years. Cancer treatment is a teamwork. Apart from the combination of radiation oncologists, surgical oncologists, medical oncologists, we need a host of other team members like the radiologists, the pathologists, the nuclear medicine team members, the nursing staff, the dietitians, physiotherapists. We are now started a department of healing, where we are talking of karmic healing is there, yoga is there, pranayam is there, meditation is there. So it's a teamwork is what I would put it, and no single size fits all is how it is. We have to tailor make it as per the patient's requirements. Surgery for cancer, it's the most universally accepted local therapy for tumors which are confined to the organ of origin, and the treatment modality depends upon what is the availability as far as the expertise is concerned and affordability is concerned. So now it could be in the form of open surgery, laparoscopic or thoracoscopic surgery, and the robotic surgery. In a certain subset of patients, we do perform surgery for prevention of cancer. So this is called as risk-reducing surgery. For example, in breast cancer, the treatment of duct carcinoma in situ is to prevent the patient from developing a cancer. In colorectal cancers, it's removal of the adenomas. Cervical cancers, we are talking about treatment of CIN or cervical intraepithelial neoplasia, and management of common high-risk conditions like the hereditary cancer syndromes, the Barrett's esophagus, and the pancreatic intraepithelial neoplasia. Chemotherapy is a type of systemic treatment which can be given in the form of injections or tablets. It is given in various settings as far as patient is concerned. The treatment which is given before surgery or definitive radiation is called neoadjuvant chemotherapy. The treatment which is given after the surgery or after Some local therapy is the adjuvant therapy, and chemotherapy can also be given as a metronomic therapy in low doses to prevent the cancer from coming back again. And chemotherapy does have its own set of side effects like weakness, nausea, vomiting, loss of hair, the reduction in the blood counts. However, all these things are short-lived and can be easily managed or prevented also. Radiotherapy for cancer, it's a high targeted, highly effective way to destroy microscopic cancer cells, and it acts by utilizing the radioactive megavoltage X-rays or gamma rays, which can actually penetrate the cell wall and damage the cell wall. Radiotherapy can be given by various modalities. The older one was the cobalt, which I think is not available. I'm not sure whether in other parts of the world it is available. In India, so it's become obsolete now. Teletherapy or external form of radiation, it can be given either by the linear accelerator with various refinements like the 3D CRT, IMRT, IGIT, VMAT, tomotherapy is available. And it can also be given in the form of implants directly inside the patient's body area, which is called as a brachytherapy. And it is also available as a radioisotope therapy also, radiation is available. We've always heard this wonderful phrase that prevention is better than cure. So whether you want to choose a nice broccoli or tablets is anyone's guess. We do want the fresh and tasty broccoli. However, if we do not take care of our health, then obviously we do not have any choice but to depend on medications. So what type of diet and cancer have a causative agent? Spicy food, a lot of hot food, red meat, canned food, and all the junk food. This is responsible for various type of cancers. While green vegetables, sprouts, fruits, these are all preventive diet as far as correct, like allowing the body to heal fast and prevent various forms of cancer. Say no to tobacco or alcohol in any form is the best way to prevent cancer and to stay healthy. Lifestyle modifications like avoid a sedentary lifestyle, stress, and obesity should be avoided. And in fact, regular exercise, meditation, pranayam, a check on your weight will definitely help you smile and lead a healthy life. Vaccines are available, particularly like the hepatitis B vaccine and the human papillomavirus vaccine for prevention of cancers. And I think every kid has the right to get this vaccination to ensure that we are able to safeguard them from developing various forms of cancers. Cancer is curable if diagnosed early is a word which all of us need to understand and embark on a journey to help the society. Cancer is curable with diagnosed early. However, how do we diagnose early? One needs to have a high level of health education regarding the warning symptoms of cancer, complete physical checkup by specialists annually, and screening tests for early detection of cancer is equally important. Now, how do we do self-examination? Self-examination is mainly as far as the oral cavity is concerned, breast self-examination, and whatever the warning signs of cancer I enumerated, one needs to be cautious and aware about detecting all these early signs as far as your own body is concerned. Every lady should learn to do a breast self-examination once a month, preferably on a predetermined date. It can be on the 10th day of the menstrual cycles. So you understand your body the best, and any small change in the body can be picked up at the earliest. There are certain cancer screening tests which include a cancer physical checkup, complete physical checkup, laboratory investigations, and radiological investigations. Why is it necessary to undergo regular cancer screening tests? Because cancer is a disease with long latent period. There are various non-modifiable risk factors for cancer. Early diagnosis is associated with more treatment options and a lesser treatment, and obviously a better cure and survival rates. What do the cancer screening tests include? It includes a general physical examination, a set of blood and radiological investigations. In addition to this, for men, we look at the prostate-specific antigen, digital rectal examination for prostate cancer, which is very common in men. And for women, we are talking about either doing the pap smear or colposcopy and the mammography. This is the way in which a pap smear is done, where we just take a few smears from the unhealthy area of the cervix. It could be either after staining with acetic acid or lugolcidine, and a few cells are taken and stained with pumpernickel stain. And once they are examined under the microscope, one can pick up whether there are any precancerous cells available in the lady's body. Cancer care is a teamwork, as I mentioned, and this is a team of consultants which is working at HCG Manavata Cancer Center. We are a team of more than 36 consultants and a team of close to 700 trained staff members who are taking care, or I would rather put it, we are in a commitment to try and bring back smile on the faces of our patients who are working with us. This is our facility at Nasik. This is the HCG Manavata Cancer Center. We have two facilities which are very close to each other. This is a 200-bed facility where we have, these are the auditorium, and this is a beautiful lawn which is there along with the amphitheater which we have. This is a children's play area because we understand the needs of children are different. These are the consulting room, the waiting areas which are there. These are the private lounges. This is a canteen area, or this is a sixth floor coffee lounge, as I would put it. And apart from this, the most important thing is our facility is situated absolutely in the heart of the city. So communication on conveyance is not an issue. Easy access as far as the bus stand, railway station, airport is concerned, very easily available. This is a photograph of operation theaters. We have a set of 8 operation theaters along with chemotherapy daycare wards and radiation department. We are equipped with the most advanced tomotherapy machine. We also have the MRI machine, CT scan, the cardiac monitoring, as well as the dual head gamma camera. This is also a PET CT scan machine. This is a radiation machine, and that's the X-ray machine which we have in our facilities. We have, we believe that any treatment offered to a patient with an honest and noble intention, the Almighty always blesses you in achieving your goals. So we believe in doing our work ethically with the utmost sincerity to ensure that every patient who trusts his or her life in us does not get cheated in any way. Until this point of time, in the last 15 years, we have done more than 93,000 patient assessments we have done. We have done almost 45,000 surgeries, more than 15,000 radiation, more than 80-90,000 sessions of chemotherapy and imaging and nuclear medicine in addition. Surgery, we have moved ahead from the era of open surgery to the robotic surgery, and as I mentioned, I've done more than 500 surgeries in just a span of 2 years. This is a facility at Nasik, which is about 3 hours or 2.5 hours drive from Mumbai. We have a campus where we have cancer center. This is the newly coming up multi-speciality center, and this is the planned mother and child care, which we expect to be functional next year. So cancer is a disease which can definitely be cured if detected early. It can be prevented if taken care of, and if unfortunately you are diagnosed, or if one of your near and dear one does get cancer, nothing to panic. We are there to take care of you, and cancer care is easily available, and all form of treatment, state-of-art treatment is available at Nasik HCG Manavata Cancer Center. Thank you very much for this patient hearing, and if there are any questions, I'd be happy to answer them. Over to you, Sandeep.
Hello.
Yes.
Yes, Dr. Nagarkar, it was quite a wonderful session, and it felt like as if we are reading a book or a guidebook on how to manage cancer as a disease. Uh, so I have received some questions from some
Yes.
some patients. So first question has been received from Ifoma. Ifoma asks, how fatal is cancer? Like, the moment patients see cancer as a diagnosis on their reports, medical reports, they get really scared. Okay. So how fatal is cancer? Should they really be worried when they see their diagnosis reports?
Yeah, I think the most
Go.
important part about treatment for cancer is understanding cancer. See, it's like, once you understand cancer, you realize that it is a easily manageable disease. And there was an era 3 decades ago where we used to talk about tuberculosis as a fatal disease. Now we do not bother talking about tuberculosis because we know that it is a curative disease. Same way, I would put it that cancer can also be easily managed even in last stage, fourth stage also. There is an option, a treatment available, and one only needs to be aware about it, be cautious about it, and face and get the right form of treatment at the right time.
Okay. Okay. Got it. Wonderful. Then there is another question. Thank you, doctor, for answering this question. Then there is another question from Alu Varshima. Alu Varshima says that there are a lot of things you covered in your presentations, like what kind of lifestyle changes one can make. Okay. Uh, are there any shortcuts to health?
There is, there is no shortcut for a perfect or to remain fit. I think whatever similar like cancer, it happens over a period of time. The body adapts over a period of time. Body has got a fantastic remolding mechanism which the Almighty has given us. So whenever the wear and tear of a body occurs, it takes some time. And if you want to get back in shape, that also cannot happen spontaneously with a simple pill or in a overnight. You have to really devote your body. It's like, take care, nurture it, and these changes to reverse usually take time. As we talk about tobacco, if you quit tobacco the day a person who has been taking tobacco for say years and years together, he says, okay, I quit it yesterday. It sounds very nice to him that, okay, I've quit tobacco yesterday. But the effects of tobacco, which he has already been consuming for so many years, last in his body for almost 2 years. It's not that you quit it yesterday and it's like switching off a button of some electrical current and everything goes back to zero stage or null stage. So one has to love your body, love yourself, and do these changes over a period of time.
Okay. Okay. Thank you. And third question from one of the client is, sorry, one of the participant is that how do you can client, I mean, can patient decide a therapy for himself, whether we have to go for a medical oncology or a surgical oncology or chemotherapy? Is there a way a patient can decide it, or you as a doctor decide it?
Okay. See now, honestly speaking, cancer treatment has become very, very standard now. It is a clear-cut protocol-driven treatment. And ideally, as a doctor, as I mentioned, it is a teamwork. It's a multidisciplinary team. Forget about the patient. It's like as Dr. Nagarkar, I have operated more than 45,000 patients. I've treated more than 90,000 patients. But I do not decide the treatment of a patient. It is the protocol or the guideline which decides the treatment of a patient. If it's a breast cancer, based on the receptor status, whether to operate first or give chemotherapy first and or give hormone therapy first or targeted therapy first, and whether to remove the breast or save the breast and do all these things have to be decided based on protocols and guidelines. So I do not think a patient is in that position to understand this protocol and guidelines. However, every patient has the right to decide what treatment he or she should get, the best treatment. And as a doctor, I put it that I would love to keep it on a platter in front of the patients. When I tell my patient that this is what I have decided for you, it is based on certain guidelines like the NCCN guidelines. I take a printout of the guidelines, put it in front of the patient that my opinion is based on these guidelines. You decide what you would like to take it. And in my practice, 99.9% of my patients, when you give them a scientific explanation, they agree to adhere to those advice.
Okay. Okay. Thank you. And now some participants on the webinar, they have asked some questions like Asake Oluwafemi Matthew from Nigeria has asked a question. We discover that in most cases when some cancer patients go for chemotherapy and few months later they die. How would you answer this, doctor?
The question is, a patient will never die because of chemotherapy. Now we are in an era that chemotherapy per se is not lethal. If a patient dies after chemotherapy, then probably the medical oncologist has not taken care of the patient after the chemotherapy well. If many a times, unfortunately, if the patient expires or succumbs, it is to the primary cancer which is responsible for death. It is not the chemotherapy or radiation which is responsible for the death.
Okay. Okay. Thank you. Ejima asked again from Nigeria, what is the success rate of robotic surgery as a treatment option?
100% I would put it. See, I've done more than 500 surgeries and I have completed all 500 surgeries. But however, robotic surgery is a tool in the hand of a surgeon. The robot itself does not perform the surgery. So one has to utilize the technology for the benefit of patient. So when I do a robotic surgery, I tell my patient very clearly that I will be performing or I will be attempting a robotic surgery. However, I will not be adamant to do a robotic surgery. If your body's contour, if the tumor or if the tissues are submissible and are right enough to do a safe robotic surgery, I will do a robotic surgery. Otherwise, I will convert to a laparoscopy or open surgery. So I think it's most important that our conscience has to be clear that whatever we are doing, we are not doing to please the robot or please the surgeon's ego. We are doing it for the benefit of the patient.
Okay. Okay. Next question again from Asake Oluwafemi. Do we have best treatments for cancer than to prevent? So I think doctor has already answered that question during the presentation. But if you would like to throw some light on it again, doctor.
There are certain treatments available to prevent cancer. As I mentioned, in breast cancer, in DCIS, we can do a surgery. In case of colorectal, if there are polyps, they have to be removed. Stomach, the polyps, they have to be removed. So there are preventive, or what we also call as risk-reducing surgeries, which are available.
Okay. All right. And then there is a question from Muhammad Sanaullah. And I think one of the last questions that I have. My question is that what is the difference between symptoms of pancreatitis and pancreatic cancer?
See, now pancreatitis is an inflammatory condition of the pancreas. It usually occurs in alcoholics or after a stone disease of the gallbladder stone, or it could be idiopathic as we call it. In case of pancreatitis, the patient will have sudden onset severe pain in the abdomen. The pancreas will get swollen up. There will be fluid around the abdomen. In the abdomen, many times there could be little jaundice also. Unlike that, in pancreatic cancer, usually the patient does not have pain to begin with. It is not a sudden onset disease. Patient can have jaundice. So there are two different entities altogether. One is cancer and one is a non-cancerous condition. So if there are any lumps in the region of the pancreas, then depending upon the MRCP and a CT scan findings, the surgeon comes to a conclusion whether we are talking about pancreatitis or pancreatic cancer. what type of pancreatic cancer, and there are tumor markers to decide that, and also the biopsy which is required.
Okay, thank you. Uh, One question, very interesting one. Uh, Sir, with this lecture, I believe that the dietary for cancer patients are more for vegetarians.
Yeah. So basically,
Okay,
I put it like, maybe I know that I'm talking to a wonderful audience from Nigeria, where non-vegetarian diet could be the staple diet of that particular country. So it's like, it's not that non-veg diet is absolutely bad. However, even in non-vegetarian diet, you should go for greens. As much greens as possible will definitely help you to take care of your weight as well as your gut also. And uh, well, I've never been to Nigeria, but I have traveled rest of the world in US, Europe, and all. People do eat non-veg, but at the same time, 70% of their meal is covered with salads, 30% in non-veg. So they compensate for the greens, for the non-veg with the greens.
okay. When you say meat, so is it advisable to, I mean, you have already said that you should avoid eating red meat. But then what kind of meat, if at all someone has to have non-vegetarian food, like fish or white meat, chicken,
Fish, fish, chicken, white meat is preferred. In fact, in India, if you go to the eastern part of India, they consider fish as vegetarian. They don't take it as
right?
a non-veg. Fish is absolutely, red meat should be avoided. Chicken is okay.
Okay,
Anything which is easily digested, that is the best form of meat to be consumed.
of course, of course. Okay, Doctor, the last question I have, sorry, this is the second last, uh, about the obesity epidemic are more prone to which cancer? Okay, obesity
Have
epidemic are prone to which cancer?
breast cancer, intestinal cancers, endometrial cancers, ovarian cancers are more prone with obesity.
Okay, now how do you define obesity? Like, for example, I mean, obesity could be slightly overweight, or uh, how would you define that?
We define it based on the body mass index, the BMI.
Okay,
Slight obesity should not be a concern, but a moderate BMI or a high BMI is definitely a cause of concern.
okay, okay. Okay, doctor, the last question that I have is from me, by the way. The last question is that various cancers have a different stages that one should know of. Okay,
Right.
though you have covered a bit of it in your presentation, can you throw some more light on that? Like a breast cancer, what kind of stages, or
See,
other cancers?
all cancers, they're basically four different stages. First stage, second stage, third stage, and fourth stage, or we can even call it as stage zero, where it is a precancerous stage, as we would call it. Now, first and second stage is usually an area where we are talking of the tumor which is confined to the organ of origin. If it's a breast cancer, less than 2.5 centimeters T1, 2.5 to 5 centimeters at T2 stage. In case of stomach cancer, we are talking about lesion which is confined only to the inner mucosa. So stage 1 and stage 2 is where the cancer is limited to the organ of origin. Stage 3 is when the tumor has spread to the surrounding lymph nodes. And stage 4 is when the tumor has spread from the organ of origin to other organs in the body, like the liver or the lungs, the bone, brain. Then we call it as a stage 4 cancer.
Okay. All right. Though, doctor, I thought it's the last question, but then there is a sensitive one. Ejima says, my mom died a few years ago as a result of chemotherapy treatment. Over time, we discovered that it began to metastasize to other parts of the body, and she gave up eventually. If there are other options, would she have survived? And what treatment option offers the best survival rate?
See, As far as Miss Ojima, it's like, well, completely, I, my, all my feelings and heart for the unfortunate demise of your mother. But again, as you mentioned, your mother has died because of metastasis. She did not die because of chemotherapy. Metastasis means the cancer which had spread to other parts of the body. So chemotherapy in her case could probably not prevent development of metastasis. However, as I mentioned initially also, now there are various treatments available like targeted therapy, immunotherapy, chemotherapy, along with cancer treatment, which can, I do not wish to guarantee that patient will be completely cured, but definitely long-term survival can be achieved and the lifespan can be increased.
Okay. Thank you, doctor. Anuj, do you have any questions?
No, but I think there's one more from the audience, and that question is,
Oh,
how could
yes,
some...
Asake. Yes, you want to ask it?
No, go ahead, you do it.
Okay, Dr. Asake Oluwafemi, how could some be able to tackle the hereditary cancer?
Yeah, hereditary cancers one has to be cautious about. Now, for example, in breast cancer, we have an option of doing a BRCA1, BRCA2 testing, wherein in case there is a high risk of probability developing cancer, then we recommend to get a BRCA1, BRCA2 testing or a hereditary germline panel of genetic panel to find out if that particular individual is at risk of developing cancer. So if there is a BRCA mutation positive in a particular young lady who is not having cancer, then we advise them a risk reducing surgery like removal of the ovaries and fallopian tube, or we advise them to do an annual mammography and regular health checkup. Because genetic modifications or alterations are not possible. And even for colon cancer, if there is a high risk of colon cancer because of heredity like Lynch syndrome, then we advise all members in the family to undergo compulsory every year upper GI endoscopy and a colonoscopy.
Okay, okay, doctor. Uh, Doctor, all questions are over. Anuj, you have any questions? Or do you want to ask anything?
No, no, I think, thank you, Dr. Nagarkar. It was really, really helpful to listen to you and specifically showing what new innovations and robotic surgery is coming to the market. And thank you for all our audience from Nigeria for joining us. If you have any questions, feel free to reach out to us. We will be happy to forward your questions to Dr. Nagarkar or probably secure answers for you guys. And if you ever need any medical treatment, don't forget HCG Manavta or MedicalTours.Care. Thank you, guys.
Just to add, you can send your questions or your queries. I have my name is Pankaj Savadekar. I've been sending you messages on your WhatsApp as well as on email. So you can send it to me on my WhatsApp number, or you can also send it to hello@medicaltours.care. Thanks a lot, everyone. Thanks a lot, doctor, for your time and the lovely presentation that you have done. And even the audience has been very patient and supportive. Thanks a lot, doctor. Thanks a lot, the audience.
Thank you. Have a great day ahead. Thank you.
Thank you. Thank you.